Hi, Dr. Robert Selig. We at Back to Natural Health are always focusing on how to get healthy. That always has to be our number one goal, getting healthy. And today we're going to talk about the house is on fire. What is driving chronic inflammation? Because inflammation is at the hallmark of every disease known to mankind. So if we can understand a little bit about what inflammation is, we can truly understand what's driving all of our chronic diseases. So today in this video, I want to have a quick presentation on inflammation. And we all know that inflammation is a normal healing body response. So when we break our leg or we fall off our bicycle, we're going to have an immune response. And in that immune response, it's going to cause pain, swelling, inflammation, redness, immobility. That's the way the body protects us, because we're having a damaged area. So the intelligence of the body is allowing us to know we're injured. Now, when we have chronic inflammation, this is a different story, because chronic inflammation is driving all of our chronic diseases, including obesity. And so what is creating this immune response? This immune response is what we call a cytokine storm. Those cytokines are your interleukins 1, your interleukin 6, your tumor necrosis factor, your nucleofactor, and an army of white blood cells, your macrophages, your neutrophils, your eosinophils. So we're being inundated with all these immune responses to our body when we're having chronic inflammation. So connecting the dots, inflammation is truly the thread to our heart disease, our diabetes, our cancer, our arthralgias, our fibromyalgia. So all of our chronic diseases have this chronic inflammation. So inflammation, so what's triggering this inflammation is the million-dollar question. And this inflammation is triggered by what we call stress. Now, stress is a multitude of things. It's not just one thing. When we're talking about stress, we're talking about the emotional stresses, the physical stresses, the chemical stressors. So it's all these stresses day in and day out that weaken our immune system, causing the cytokine storm of inflammagens that predispose us to all of these chronic diseases. Now, what are some of the signs and symptoms that you may be having some chronic inflammation? Well, one of the most common ones is just pain, chronic pain. The chronic knee pain, the chronic back pain, the chronic headaches, the chronic sinusitis. Those are all signs that your body is inflamed. You're truly burning down the house. Brain fog, can't remember where I put my keys, can't remember what that person's name was that I just met 2 minutes ago. Our inability to really think clearly and intelligently when we're inundated with this brain fog. Another sign and symptom is sleep issues, not being able to sleep uninterrupted. We're waking up, we're going to bed tired, waking up tired. We're always getting disturbed sleep patterns, waking up 3 times a night to go to the bathroom. We're waking up because the boogeyman is scaring us. For whatever reason, we're not sleeping a full 6-7 hours of uninterrupted sleep. And sleep really is truly something that we have to prioritize if we are going to get healthy. Also, another pretty common sign and symptom is this excess belly fat. BMIs over 25 are, that's a flagrant foul. That's an absolute sign that you're in inflammation, as the fat tissue, the adipocytes are releasing their cytokines, causing another host of wave of inflammation. So the BMI, the belly fat, and the hormonal dysfunction. So when you see all these horrible hormone problems, from the adrenals to the thyroid to the PMS and the estrogen dominance, this is all having to do with inflammation, is the hallmark of all this, because what we're realizing is that this inflammation, behind inflammation, insulin resistance is driving all of our inflammation. So it's understanding this hormone connection to this. Also, another sign and symptom is food allergens. You know, we eat certain foods and we don't get an acute reaction like someone may eat a strawberry or a shellfish and their throat swells up and they have to run to the emergency to get their epinephrine. That's an acute allergic reaction. I'm talking about more the chronic allergic reactions where it's not as obvious as an acute allergic reaction, but still it's going to cause a wave of inflammation that over time, how do you know that you're eating foods that are causing inflammation? It's more like the gas and the bloating, the distension, the fatigue after eating. Certain foods just make you feel not so good. So it's understanding how food is a huge, huge player in what's driving this chronic inflammation. Another sign and symptoms is just low energy, fatigue, no energy to do anything. That's a sign that your body is burning out. The house really is on fire as you're burning out your adrenals, burning out your thyroid, and we're inundated with this chronic fatigue and low energy. Also, another sign and symptom is, gastrointestinal disturbances, and that's everything from, the constipation, the diarrhea, the gas and bloating, to the more, when we're having infections in our gut that really are wreaking havoc on our immune system, triggering a storm of inflammation. So how do we truly know? We have some signs and symptoms, and now how do we know if we're really inflamed? Well, this is where lab testing comes into play. So first thing, I'm always asking my patients, about their signs and symptoms, so the red flags go off in my head and I know that, we got some inflammation going on. Now let's test to see really what are the markers of inflammation. And one of the great ones is, this is just a normal a CBC, a complete blood count, is C-reactive protein. CRP, when you have cytokines are going to go to your liver, and then your liver is going to release C-reactive protein. It's reacting to the cytokines, and any C-reactive protein above 1.0, you're inflamed. I've seen those numbers as high in my office. I've seen people come in with C-reactive protein above 10, at 11, at 12. I want to see that number always under 1. Another good lab testing tool is triglycerides. So triglycerides, when they're above 100, you're inflamed. Even more important is a ratio of triglycerides to HDL, and we want that ratio to be under 2. So if you had triglycerides at 101 and your HDL at 50, your ratio is going to be above 2. Ideally, we want a 1-to-1 ratio where our triglycerides are maybe at 80 and our HDL is at 80. Then we know we don't have inflammation. Another marker on lab testing is fibrinogen. Fibrinogen is for the clotting factor. So when I see fibrinogen numbers above 250, that's increasing the clotting, decreasing the blood perfusion. When we're not moving blood, that's never a good thing. The blood becomes thick, it becomes sticky, and so we're not moving blood, which is the juice of life. That's becoming very stagnant, and we're not moving the goods into the cells. So fibrinogen is also a good marker of inflammation. Uric acid is associated with the gout, and so whenever I see high levels of uric acid, that's a flagrant foul of inflammation. Also, I always want to run stool panels because one of the biggest causes of chronic inflammation is chronic gut infections. We know, I've gone blue in the face saying our immune system is in our digestive tract from mouth to anus, and when our gut when we have chronic gut infections, that must be tested, because one of the first strategies is to get to those chronic infections. We have to get that under control, and this is where our inner terrain and our bacteria is so important. So I will run a stool panel, and in that stool panel we're going to see if you have H. pylori, giardias, all these other infections from parasites to fungus and candida. So stool panel is huge in detecting if we have chronic infections, because like I said, chronic infections in the gut is one of the #1 contributors to inflammation. Cortisol. Cortisol is going to be a saliva sample. We're going to take 4 samples of cortisol. In the morning, cortisol should be high. When you go to bed, it should be low. So there's a diurnal pattern of cortisol. And cortisol is the stress hormone. So stress, when the cortisol is off and we have stress, whether it's the physical stresses, the emotional stresses, the chemical stresses, it's usually all of them, to be honest. And when the stresses are high, your cortisol is going to be off. So looking at cortisol is one of the greatest tools for me to see, do you have chronic inflammation? Also, another great test is, and I see this almost in everyone, I see low vitamin D. So when I test patients vitamin D is really, it's a hormone, and that hormone vitamin D is truly how we strengthen our immune system. So I want to see vitamin D between 50 and 80, more to the 80. When your vitamin D, when your 25 hydroxy vitamin D is at 80, you don't get sick. So we will incorporate strategies to make sure we're getting our vitamin D levels up to optimal levels. So these are some of the lab tests that I will run to see if we are under excessive stress causing all the chronic inflammation, causing all the chronic diseases of modern man. And also, if I have to dig deeper, I may run a Lyme test. I may look for other co-infections that may go under the radar, so we have to dig a little bit deeper. So when a patient comes to me, I'm always trying to see what are the markers of inflammation, because like I said earlier, inflammation is the hallmark of all our diseases, and specifically all of our chronic diseases that we are plagued with. Epidemics of diabetes, of heart disease, of cancer, of arthralgias, of fibromyalgia. So all this chronicity has a player, and that player is the inflammation. And the inflammation, we want to get to the root of what's driving the inflammation up. So today I just wanted to give you a brief introduction on what chronic inflammation is, what are some of the triggers of inflammation, and what are some of the lab tests that we run for inflammation. And in the next video series, I'd like to talk about how we address chronic inflammation. So if there's a problem, there's always a solution. And the solutions that I employ at Back to Natural Health will always be more of a nutritional, homeopathic, detoxification, getting the body out of sympathetic into parasympathetic with certain modalities, from chiropractic care to PEMF to infrared sauna. So we have a host of many therapies, and I would like to talk about the therapies we offer in my next video when we're dealing with chronic inflammation. So thank you for watching, and go out and enjoy this beautiful spring day. Thank you.